So my name is Jacques Montplaisir, and I started a sleep disorder clinic in Montreal a long time ago. Actually, we got set up in 1978. I was very interested in sleep and sleep medicine very early in my life, actually. I should say one day I was looking in the library when I was even in college, and I saw a book on, that was relating all the presentation at a meeting, and I was fascinated by these things that I had no idea exactly about the study looking at people during sleep and waking. And so I decided after my medical school to get to into sleep research. So originally I wanted to go into memory and sleep, and I applied in the Department of Psychology to do more study into cognitive function. But then I heard William Demand, who gave a talk when I was in my first year postdoc at Caltech. And so he came to Caltech, he gave a course, and I said, that's what I want to do. So I changed my appointment actually from a laboratory working on memory to the sleep lab. And I've been working in sleep and sleep medicine ever since. Of course, when I returned to Canada in the mid-70s, there was nothing on sleep and in human and sleep medicine. So I had to work hard to get sleep to the population. I remember the first year I came, I went on a radio program, like it was 45 minutes every morning. So I go to sleep and then to all the sleep disorders one by one, on sleepwalking, restless leg, and so on, and narcolepsy. And from that I got a lot of exposure in the television show because people got interested, and then I started the course for physicians and started the really career in sleep medicine. I was more on the research side, but although maybe 2/3 of the research side, 1/3 in clinical and seeing patients, and I realized very early that we were very poor in terms of available treatment for sleep medicine. It came early. And then we developed a center in Montreal called the Center for Advanced Research in Sleep Medicine, and where we were, progressively we went up to about 15 researchers, and we had like 25, 30 graduate students. And so I was very happy actually to contribute to train, because the students, and many of my students are actually faculty in different parts of the world, in Europe, in the United States, in Canada, and even in Japan, and and they will perpetuate. I mean, the field, and it will grow, and actually they have a graduate student of their own at the moment. I think like a grandfather in the organization, and that really fulfilled my life very much. So the students are really great and very fun actually to work with. Bill Diamond was very contagious about sleep and sleep medicine. So everyone who will meet him will rapidly get really enthusiastic about the field. And so working in his lab was also a major influence on the way I built my practice afterward. I mean, there were a lot of fellows at Stanford at that time. And so I felt the need to have more students and postdoctoral fellows, because they really help each other and they feed each other. And I also felt the importance of coming to the sleep meeting as a way of education. We presented more than 250 presentations at the APSS, over the years, mostly by my graduate students and myself. And I think that played a very important role in training these students. I mean, they were coming to the United States, they will give their talk, and they felt really more professional afterward, and it motivated them to work harder. So that was a very nice experience. I was in the clinic. I was, of course, collaborating very much with Christian Guillemino, and But very rapidly we got into collaborative research, because I was a clinician, but I was also a PhD in neuroscience. So I was working in the animal lab on 2 days per week, and 3 days per week I would go to the clinic, and so I would start to see patients with narcolepsy and so on. We were very active in organizing the first narcolepsy meeting that was held in Montplaisir, and with Christian, I remember we had 3 chapters in that book, and so it was a very productive period of my life. And and then I got to psychiatry afterwards. I went to McGill University and completed my training in psychiatry, because I felt that I needed that also to see patients. I mean, there was one way to look at the sleep problem as well. So I had more background in neurology, but then with the psychiatry, it was a good complement. It wasn't very easy actually to get started in Canada, because but hopefully, I had done all my training in Montreal, and my PhD in neuroscience and so on. So I was not a stranger with weird ideas. So so when I came but I had friends in the physiology department where I did my PhD in neuroscience, and some of the staff there, they were also working in the hospital in Montreal, not the university hospital, rather smaller actually hospital, and we started very small. I would say for the first 2 years, I had like one office, which was a prayer room for nuns. And my lab was exactly the same. So we had 2 rooms like that to start. And I had borrowed a EEG apparatus from the physiology department where I studied as a graduate student. And I had the wire in the corridor. And but very rapidly, because I got my grant from the first years, I got a grant from the Medical Research Council of Canada, and that helped me to hire technicians, and then I have graduate students and so on. But I would say the first 4 years were sort of difficult in that respect. But then we moved, of course, to other locations in the hospital. We even built this Center for Advanced Research in Sleep Medicine, where we had probably 15,000 feet, which is quite big. We had, we bought some equipment even for brain imaging, and we were doing genetic studies. So it diversified very much as we grew older. And actually, I should say that the other faculty joined me, and they had but many of the first faculty, they were trained with me originally, but we sent them to different places for their postdoctoral training. Some went in Harvard, some went at Stanford, some went in other locations, and they returned, and they had their own background, and we were able to really to start working as a group. There was no sleep center in Canada at that time. There was Roger Broughton, who was in Ottawa, who had started the consultation, but he didn't have like a real sleep clinic. He was doing a personal practice at the University of Ottawa, and he was there about 2 years before actually I arrived, and he was coming from a postdoctoral training in France, and we worked together as well. When I first arrived in Canada, but there was nothing in Montreal, and but it was well received. I should say I didn't have too much problem to convince people. That we should develop sleep medicine in Montreal. Originally, my research focused on narcolepsy. I had worked on narcolepsy at Stanford, but I very shortly got interested into restless leg syndrome, and we did the first epidemiological study actually on a large population, showing that a very impressive percentage of the population were affected with restless leg, and we found that the restless leg was almost double in the French-Canadian population compared to the English-speaking population. And there was a founding gene probably coming from the southwest part of France. And, and then we did a lot of study on the restless leg, on the genetics, on the treatment, dopaminergic agents, and every other aspect of restless leg, developed method for diagnosis and so on. And but we were also interested, well, in narcolepsy, of course, and hypersomnia. I think that was a great part of the clinical population as well. I mean, since there were nobody before, so we were sent with all the narcoleptics. So we did some research on narcolepsy as well, and like on HLA. Actually, that was a frustrating experiment because we found that the narcolepsy were all HLA-DR2, but it took 2 years to do that because we were sending the sample to Ottawa and the sample will freeze in the transportation. So we had to have the patient back and so, and then they announced the meeting at Stanford on narcolepsy. We were there to present and just a week before we left Montreal, and then there was a published in Lancet, and on a very small, we had like 250 patients, but it was on 20 patients, but they just said they were all HLA-DR2, like we have found the same thing, and so it was exciting, but it was also frustrating. Anyway. So that was part of the study that we were doing in narcoleptic patients. We shortly got interested into what we call idiopathic hypersomnia, which sort of becoming a major center of interest in sleep medicine, because it's a large, because originally we thought it was a very small percentage of the population. When we rapidly realized that if we extend the concept, it includes a lot of patients, and they don't respond as well to the psychostimulants that were developed for narcoleptic patients, and it's a major issue. So we're really a center we're doing much more research now. We have a bank for recordings and also the blood, and looking at the genetics and the other defect in idiopathic hypersomnia. We have 2,000 patients with idiopathic hypersomnia. So over years, we were saying probably 2,000 patients per year, and just before the COVID started. And now we are 4 full-time physicians working with in sleep medicine. And the other 3 have more neurology background. One is a PhD in neurogenetics, and so we have all kinds of different specialty. One is neuroimaging, and so and there's also a lot of PhD who works and have their own interest in sleep medicine as well. Originally, I was in the Sleep Research Society, and so and I went to the first meeting in '74. And then but Bill DeMen actually was doing was traveling across the country, giving conference everywhere to build the interest in sleep medicine, but I was not directly involved in this process, but although at one point we met at the Chicago airport at the hotel, and then we were only 6 people. I mean, specializing in sleep medicine, and they were from New York, Chicago, and from the United States, and more or less that was the time where we sort of set up the basis for sleep medicine organization. Elliot Weitzman was from New York, and I remember Bill DeMan was there, and Red Chapman, I think, was there. And I was just returning to Montreal, just finishing my postdoc, and I thought I was invited in Chicago. So I got there, and with all the leaders in the field at that time. So I feel very very happy to be in something that was really emerging and exciting. And I think Buildement played a major role in making this journey very interesting and exciting. I always been in the SRH, and then we did the Canadian Sleep Society, and and then being in sleep medicine is, you get interested in a lot of different things. I organized the world meetings on the sleep apnea in Montreal, and we had to work with sleep apnea because it was a major issue in the society. And even though we were more from basic neuroscience and so on, we shortly become specialized in pneumology and sleep apnea syndrome. But in Canada, yes, I participated in the Canadian Sleep Society. Yeah. Not really. I think I've never been really I didn't play a major role in organizing association. I was very active locally to build the centers, to get money from different sources to organize the whole thing. And even I created a network in Quebec and then we had a sleep part of it, but I was a network in mental health. So I was the director of a mental health network in Quebec, and we had a network in sleep, but it was really local at that time. And it grew up afterward because the Charles Morin came back also from the United States, and we started to have a larger population of sleep researchers and sleep clinicians. I would say the Sleep in Canada probably evolved in parallel to sleep medicine in United States. I think the link has been probably more north-south than east-west. So we were collaborating a lot with the centers in the United States, and the other people in the West were also collaborating with people in California and some other place. And the Canadian, Canada is, it's a small population, not so small, but we all live within 100 kilometers from the United States. So, you can imagine like 4,000 miles and then just 100 miles wide. So I think it's much easier, to collaborate with United States than across Canada. And things have changed because the Medical Research Council sort of encouraged the Canadian network and so on. I think, and people are doing much more now, but at that time it was really, and for a long time, it has been more north-south collaboration. The American Academy of Sleep Medicine and the American Association of Sleep Medicine, and the APSS, they play a major role, in the development of Canadian sleep research. Of course, that's why we always had our students come to the APSS meeting, and actually we didn't have a training program in Canada. So if you want to take the board, you take the American board, and so that would make it very close to the organization in the United States. And Canada has other advantages because maybe being also spread in the population, and I think it makes us free, to collaborate, but then we can also develop our own program at the same time. And it's probably less competitive probably than being in the United States. So we can collaborate easily with people in Europe or United States, and Australia and other places, but intra-Canadian structures, it's interesting, it's very friendly, and it's very productive. Canadians have been very productive, actually, in sleep research compared to the number of researchers. And I remember someone saying at one time, the reason for that is December, January, March, and April, which means that in winter, so you do work hard. And I think it's Meyer Krieger said that at some point. And I think Phil has been productive and impressive, actually, the contribution of Canadians. I guess it creates the really the structure, and we work with. I mean, the criteria for diagnosis, the guidelines for treatment, and things. These things emerge from the American Academy of Sleep Medicine and Sleep Research Society. So I think that's very important. And probably all the, when I think of people in my lab, most of them have been trained in the United States during this postdoctoral training and returned from Canada. So I don't see the American Academy as being a structure outside my immediate environment. I mean, I feel part of that. I mean, we don't see the frontier. I mean, when you do this kind of work, I mean, and research, and I think it has been very easy to collaborate. I mean, and we still do. I mean, we collaborate with Emmanuel Mignot on narcolepsy and the genetics, and now we start having also collaborative study on sleepwalking, in the genetic of sleepwalking, people in France also, and I think science has no geographical limit, and I think. And the origin was very much although there have been a lot of initiative in many countries, discovery of narcolepsy in France or other places, restless leg in Italy and so on. But I mean, as an organization and putting all these things together and promoting, I mean, a general, profile of sleep medicine and people who qualify for sleep medicine, I mean, set up standards and so on, I think is very important. At some point, I felt like the sleep medicine was almost overwhelmed by sleep apnea. And I think everybody felt that. I mean, because I was there before actually sleep apnea was even discovered, and after, and we felt there was big pressure in all the meetings. I mean, like more than half of the presentation were on sleep apnea. And I understand that. I mean, I even organized the world meeting on sleep apnea. So, but we felt that when working on other fields, were a little bit less represented in meetings or everywhere. So I remember because I was working in patients with epilepsy, recorded with depth electrodes, and I presented a few times at the PSS, and then decided I would go to American Academy of Neurology because the interest was not really there. And but now I think it's so. I realize at this meeting in particular, the representation of other aspects of sleep medicine, I mean, other than sleep apnea, is sort of coming back, and there are more and more exposure and interest in the other aspect of sleep medicine. I don't blame the people in sleep apnea, but also they probably join more and more, like the American Thoracic Society and other, I mean, in pulmonary medicine. So there's less pressure in sleep medicine to be responsible for promoting, I mean, sleep apnea research and treatment. I don't know. I think we have to realize that, I mean, probably starting with the Academy of Sleep Medicine, that sleep is now pretty much developed in many, many other countries. It's very big in other countries. I teach in Australia for a while, and not for, I mean, a few days in a row, but I found that, I mean, they were very knowledgeable about sleep and sleep. In Japan, I mean, sleep research has been very well developed, especially in narcolepsy, but also restless leg, other conditions as well. I had to travel a lot, I mean, during my life, giving lectures in different countries, and I think the effort, I mean, that probably originated from sleep medicine, from the Academy of Sleep Medicine, sort of reaching out to many other countries. And sometimes it's interesting to see, I mean, people developing a very in-depth research program in unexpected places, as much as I'm concerned. Well, the American Academy of Sleep Medicine, and also I think we should talk about the Sleep Research Society, I think, and became the APSS, which become the American, I mean, the Professional Sleep Society. I think because I mean, they set up the field, I mean, to get to the American Academy of Sleep Medicine. But I think probably a major role of the academy was also the training of and setting up, I mean, standard to practice sleep medicine. I think that plays a major role in the development of the field.